This class is about shoulder pain, so we're going to go over several shoulder muscles, including the rotator cuff muscles, and I'll break down the rotator cuff muscles at the end. Deep in the armpit, on the front of the scapula bone, the shoulder blade bone, there's a deep muscle called the subscapularis. It runs up to the lesser tubercle, which is located on the very front, very top of the humerus bone. And when it contracts, it rotates the humerus bone inward towards the scapula. This is called internal rotation. You can do that to the humerus when the humerus is in almost any position. You can internally rotate it. The teres major comes from the very bottom tip of the scapula, and it also can internally rotate the humerus. So they're both called internal rotators. On the back of the scapula bone, the shoulder blade bone, there's a muscle called the infraspinatus, which is large, kind of like the subscapularis, but on the back. And it runs to the back of the humerus bone to an attachment called the greater tubercle. It's a big bump on the outside and back of the humerus bone. Below that is the teres minor. So there's two muscles called teres, but the teres minor comes from the back of the scapula, and it runs up with the infraspinatus muscle to attach to the greater tubercle. So all four of these muscles, two of them, the first two I described, are called internal rotators. The last two I described are called external rotators, and together they form what's called the rotator cuff. They look kind of like a cuff, or they form a cuff as they attach to the humerus bone on both sides. Two of them are capable of rotating the humerus bone internally, two can rotate externally. That's all the rotator cuff is, it's nothing else. So the rotator cuff can cause a lot of problems, including nerve impingement of the radial nerve between the two heads of the teres muscles, and the triceps long head can get involved with that. And so we're going to go ahead and go through how to release the rotator cuff muscles. This isn't for frozen shoulder specifically. It's for rotation, so the other rotator cuff muscle problems. The supraspinatus muscle actually is not considered a rotator muscle because it only elevates the humerus and is involved with lifting the shoulders, so that's a frozen shoulder problem. It's a different class. So this is about the rotator cuff muscles and the nerve impingements it can cause and the horrible pain it can cause, and it's a great course. So go ahead and check out all the techniques for all the muscles involved, and we'll see you on the other side. Make sure to do all the drawings and videos and testimonial at the end.
Let's say you tried to arm wrestle and you felt kind of weak. Or let's say you tried to backhand someone and you had a sharp pain in your armpit. Both of those problems would be due to the same muscle, the teres major. And another muscle called the subscapularis, but I'll show you those in a second. The teres major is the cousin to the teres minor, but they pull in different directions. The teres major is an internal rotator, so it helps with the arm wrestling motion. And if you try to externally rotate, like to do a backhand motion, that would hurt if that muscle's tight. So the way to release it is to stretch it towards the armpit, towards under the armpit, with one thumb, and to pin it down and brace the stretch with the other kind of hand holding the scapula, and the thumb going into the muscle itself. So between the two thumbs, you try to stretch the muscle towards under the armpit and try to get point releases with yang-yin pulses as you're finding the tight spots and the tight band of the tight fibers of the teres major. You can definitely feel it and trace it, as it goes under the armpit. By releasing this muscle, a lot of times you can release the radial nerve. So the radial nerve runs down through the triceps and through the back of the forearm. And this muscle definitely needs to be released in order to release the radial nerve if it's trapped under the teres major. And also the axillary nerve that goes to the deltoid travels between the teres major and the teres minor as well. So yeah, you have to release the teres major and the teres minor in order to release the axillary nerve. So this is potentially a really important muscle. It also works with both muscles work kind of with the latissimus dorsi, and will be tight a lot of times if the latissimus dorsi muscle is also tight. Sometimes you have to release the latissimus dorsi also to release the teres muscles. So I think let's go ahead and show you the subscapularis muscle. The subscapularis muscle works with the teres major. It's a larger muscle, though, because it comes from the entire anterior surface of the scapula. It's a big area. So think of that whole shoulder blade bone. All the way across there is its origin. And we don't normally think about the front of the shoulder blade. It's not out there where the pectoralis muscle is in the front plane. It's a plane that's further back in, deep into the body. It's right on the very front of the shoulder blade. It comes from there and it goes to the front of the humerus bone. So when this thing contracts, it does like the arm wrestling motion and rotates the humerus internally. And if you were to raise your arm, it would hurt. So a lot of times if someone can't raise their hand up to the sky, if they get a sharp pain right there, it's because of this muscle, the subscapularis muscle. So the way to release it is you put the humerus in a stretched position the way I'm doing. This stretches it into, this motion is called external rotation, and this muscle, when it contracts, it does internal rotation, right? So this is stretching it out and holding the pressure point at the same time. By stretching it and holding the pressure point, it allows me to get into that yang cycle where I'm really focusing pressure in, I'm challenging the stretch, taking the stretch as far as it can go. And I'm telling it, okay, relax. And after I do that for a few moments, maybe up to 60 seconds, I slowly start backing my pressure out, and that triggers a release. If I trigger the release, I feel it start to melt under my fingertips, and the whole muscle just starts to let go. And what I do is it's kind of an illusion feeling. I make it feel like I'm backing out, even though I actually don't back my pressure out. Even after 30 seconds, it appears to be the same amount of pressure, and it still is a very firm pressure, even after 60 seconds. So that's the yang-yin pulse explained again. I know I say it over and over again, but you can't say it too much because that's really the trick. So anyway, yang-yin pulse on the subscapularis after the teres major, and the person should be able to do a backhand all the way with no pain whatsoever. Okay, if those are not releasing very well, go to the rhomboid major. These are antagonists, right? The rhomboid major works. We went through the rhomboid minor, and I talked about the rhomboid major a minute ago, but the rhomboid major is so connected to the subscapularis that I want to go over it again. So see, it comes from T2, 3, 4, and 5, the spinous process of those vertebrae, and it has a 45-degree angle down to the medial border of the scapula, which means like that inside edge of the scapula, the edge that opposes the side we're working on. So we're stretching that edge, that scapula, away from the spine, and I'm pressing into the muscle and using the edge of the scapula as like the backboard, right? So I'm holding that stretch. I'm stretching it actually at a 45-degree angle down, sort of, down towards her forearm. And by holding the stretch, it allows me to get into that yang mode. So I'm, stretching it more and more, really intensifying the points, and then I start backing my pressure out, making it feel like I'm backing out, even though I don't go anywhere for maybe 60 seconds. So you can go ahead and start doing yin now, actually. So you only need to do yang for so long. Okay, let's do yang a little bit more, a little bit more, and then now start backing your pressure out. Make it feel like you're backing out, even though you don't go anywhere, if you're trying to do this technique. Otherwise, just watch. And by backing out, see the scapula is starting to move away from the spine. Did you saw it move? So that's the idea for the rhomboid major. So if you release the rhomboid major, there's really almost no reason for the subscapularis or the teres major to still be tight. If you go back and check them, you'll see that.
If you were to cross your hand over your heart or reach even further and touch the shoulder on the other side of like your left shoulder with your right hand, that motion is called anterior adduction. Or if you're to clap your hands in front of your body, that's called anterior adduction. If that motion causes pain in the back of the shoulder, that's a problem. That's usually because, it's generally going to be caused by spasm of the infraspinatus muscle. So the infraspinatus muscle and another muscle called the teres minor muscle have to be released to release pain there. Let me show you how to do that. These two muscles are called the external rotator muscles. We hear about the rotator cuff. These two muscles are half of the rotator cuff. And, they're the only muscles that do lateral rotation of the humerus bone. So if you were to backhand somebody, these are the muscles that do it. If you can't cross your arm in front of your chest, it's because these muscles are in spasm, and they also limit rotation. So if you were to look at your wristwatch and, it's kind of rotating the humerus under, and actually it's, with the wrist, but your humerus also rotates a little bit. And if you wanted to rotate your arm further, that's internal rotation. And that motion would also hurt if these two muscles are in spasm. So to get the infraspinatus to release, you have to stretch it across that span from the scapula over to the humerus and find a good solid spot to press into it. The points over here can really hurt, by the way. You have to be very careful to not make the person jump off the table. Although usually the more painful the spots are, the more you're kind of right on the right spot. So you have to do both at the same time. Work on the worst spot and also be very careful and don't make it too painful. So hold the muscle into a stretched position while you gently increase your pressure into the point, seeing if they can handle it. And as you stretch and brace with the other hand, you can slowly build pressure, and this is called yang mode. This is to penetrate the point, make sure the point knows you're there, and you're stretching the infraspinatus muscle. So you're stretching it, you're holding the point. Now start backing your pressure out. Make it feel like you're backing out, even though you don't go anywhere for quite a while. And try to trigger the release. When it starts to release, you'll feel tension drop across that bridge between the scapula bone and the humerus. And you'll feel like the underside of their arm, like the underside of the bridge, actually like flattens out. So you feel like their armpit can kind of lay more easily on the table. And what you're doing is you're releasing the external rotator muscles. So internal rotation all of a sudden becomes a lot easier. So just repeat the process in that muscle a couple times just to make sure it releases all the way. So the infraspinatus muscle, it's stubborn. So you usually have to do at least 2 or 3 releases in it. And it's not that big of a muscle, but it's kind of triangle shape. Follow the upper border of it over to the shoulder where it inserts, and follow the lower border of it. See if you can make out what the upper and lower border are. And usually right in the belly is the best spot, but you have to kind of follow the seam of the edges of the muscle, of the infraspinatus muscle too. And just try to find those fishing line thin fibers of tension that run through it. And if you can release those, you'll release so much pain in the back of the shoulder. And also releases here will release the rhomboids and pain that people experience in the upper back. So I know this is for the shoulder, but it's kind of connected to the shoulder. And if you want to release a rhomboid area, you have to release the infraspinatus. And also, of course, this releases the movement of internal rotation. So now this person would easily be able to reach over and touch the other shoulder, crossing her arm in front of her body, or like twisting her arm from the humerus, where she's like rotating her humerus inward, so into internal rotation. Okay, I think we've shown you the infraspinatus enough. Let's show you its counterpart, which is called the teres minor muscle. The teres minor muscle runs below the infraspinatus. Hold on, let me show you like the very tail end of this infraspinatus release first. Oh, the infraspinatus, by the way, is on the small intestine channel. And the small intestine channel runs through the forearm and actually up into the face, into the cheek. So if you want to look at the small intestine channel, you'll find other muscles that you can release that will actually release the teres minor. That's part of the Releasology training, by the way. The teres minor is the counterpart. It also is the lateral rotator. So all the mechanical things are the same as the infraspinatus. The release technique is basically the same too. It follows a path that's beneath the infraspinatus. So the teres minor is it's kind of like a thin pie slice, like the smaller pie slice between the two, and it runs a little bit lower. But when it's tight, it can cause a lot of pain, and it causes that tension where if that thing is locked up and you try to cross your arm in front of your body, it's going to hurt. And if you try to internally rotate your humerus, if you're like arm wrestling or something like that, you'd feel weak along those fibers that do that part of the movement. So this is also part of the small intestine channel. So if you follow the small intestine channel down through the back of the triceps and the forearm, they basically run along the lower third of the back of the forearm, if that makes sense, on the like pinky side, if the thumb side was the upper third. That chain runs down, the small intestine chain of muscles runs down through that area from this teres minor muscle. And the teres minor is an antagonist for a muscle called the teres major. The teres major comes from a similar origin, but instead of crossing to the back and attaching to the humerus, so it's a lateral rotator of the humerus, the teres major is an internal rotator. So that's not the muscle we're working on now. This is an external rotator. So we're holding the humerus in kind of an internally rotated position, and also pulling it away from the body at the same time. So it's both abducted and internally rotated to give an optimum stretch. So it's in a stretch position, and we can easily just find the muscle where it stands up, find the tight points and the tightest bands of that muscle. You've seen it on the chart if you're not quite sure what I'm talking about, but that's where I'm pressing. And you just want to kind of pin it down, hold the stretch, and do your yang yin pulses to release over and over for both the infraspinatus and the teres minor. So, the teres major and the teres minor, they pinch a nerve called the axillary nerve, or some people say axillary. That's the nerve that comes from the axilla and goes back to the deltoid muscle. It's basically the only muscle that goes to the deltoid. So if the teres major and the teres minor are both in spasm, it'll definitely lock that nerve. And you're always going to have spasm of the deltoid, which can be involved with the frozen shoulder. But it definitely will cause a lot of pain through the deltoid, and it'll feel like it's emanating from this area, from the teres, from the outside lower part of the scapula. And releasing both of them is really important. And the infraspinatus, though, is probably the trickiest. So I think I'm going back to it in this demonstration here. I'm releasing it a little bit more. And then let me go back down to the teres minor and get that a little bit more. So those half circle techniques that I'm doing, that's a way of finding the tight fibers. So you do those little half circles, and it helps your fingers differentiate from the loose parts of the muscle to the fishing line tight nylon-like fibers that are tight. And that's where you want to focus your releases. Wherever you feel those tight nylon bands, that's where you want to focus your pressure in. Do your yang yin pulses. And by the way, if you're ever not sure where muscles are, we have the drawing exercises throughout the website for every single muscle in the body. So please use those exercises, print the printouts, and get a red pencil and practice drawing the muscles from origin to insertion, just to, it doesn't have to look like artwork, but just for yourself to make the mental connections of where you think the muscles attach on the pictures of the bones that are provided in the worksheets. Those are invaluable exercises to do along with doing these technique exercises from the video. So here's a small intestine channel. You can see its pathway through the back of the arm and up through the neck, like I was saying. And it runs along the cheek up to the cheekbone. And let's go ahead and look at another muscle. So you know how the infraspinatus and the teres minor cut across the bottom of the scapula. Well, what pulls on those muscles that could set them off and make them feel like they need to tense up? Well, you always have to look at the antagonists. They pull the medial border of the scapula towards the humerus. So what pulls the medial border of the scapula in the other direction? You have to say the rhomboids. So let's start with this rhomboid minor. Sometimes you have to release the rhomboid minor for the reason that it's on the same muscle chain. It's a small intestine channel. And to release it, we have to stretch it down and away from C7 and T1 at a 45-degree angle. So you hold the pressure and slowly build up your pressure, focusing into the muscle. Just really nail the pressure point right in the middle of the tightest fibers, and then slowly back your pressure out, triggering the releases. Okay, let's try it again. So find the rhomboid minor. Use cross-fiber palpation to figure out exactly where it is. It comes to kind of the upper angle of the scapula. And it's not the levator scapula, which comes from the neck, but it comes straight from C7 and T1 over to that angle, or to the angle of the scapula, kind of edge of the blade there. So push it out at a 45-degree angle, down and out, holding the pressure. And make it feel like you're backing your pressure out, even though you don't go anywhere for about a minute maybe. After you're releasing, you feel the scapula drift further and further away from the spine. But you have to usually repeat it a few times. And when you do the pressure point release, by the way, you should be able to feel energy go through your body. there's, I believe, a transmission of electrons, like I've said before, and it comes out of the tight muscles into the ground. But you have to really get like the entire muscle to let go. Otherwise, it still has kind of an interrupted electrical field. Once you release the muscle tissue all the way, then it really sets up for a permanent healing, you could say, for the body, and because the muscles stay released for a long time. But it's because normal blood flow is restored. You know, what happens when a muscle lets go? When a muscle lets go, blood can finally flow into that muscle after it's been in spasm for a long time, and toxins are cleaned out. Toxins meaning the lactic acid and the carbonic acid that builds up as a metabolic byproduct when muscles burn sugar. Just like any other cells in the body, muscle cells burn sugar. When they burn sugar, they make, if it's in a healthy condition with oxygen present, they make carbonic acid. If oxygen's not there, then they burn sugar and they make lactic acid, which will make the muscles more and more sore. That kind of soreness that you feel in tight muscles, and that's why it's because they're acidic from the lactic acid. And when you release a muscle, blood rushes in and it cleans that acid out. That's why muscles feel soothed and a lot better after you do the release work, because blood and normal blood flow and circulation is restored. And not only are the toxins cleaned out, but think about it. Oxygen is brought back in. Carbon dioxide is moved out, and the muscle's just ready to go. The most important thing is that electrolytes are restored. If electrolytes aren't present in the blood, the muscles are not going to let go, by the way. You can try over and over, but if electrolytes are in the blood and you restore normal circulation, then you restore a normal flow of electrolytes to the muscle tissue. And that's what really keeps the muscles from cramping. It keeps the muscles from locking up again for the long term. When muscles just, don't let go, headaches don't go away, shoulder pain doesn't go away, it's because the electrolyte flow into the muscle tissue that's having trouble with tension is just not there. It's not enough electrolytes. So anyway, once again, just want to remind you, you can always try releasing muscles on the same channel to help the muscle you're releasing release better. Because if it's not releasing and you try a few times, there's probably another muscle on the same channel that's tight. So go and check all of them. This again is the rhomboid major. So the rhomboid major, it attaches to the very bottom angle of the scapula, kind of the bottom of the scalpel, right? Bottom of the shoulder blade. So you can see it kind of running down at a 45-degree angle from where my lower hand is, running from there down to the tip of her scapula. And I was doing yang-yin pulses, stretching the muscle, and doing releases to get that. Okay, now you know how to release the infraspinatus and the teres minor. So, thanks for watching, and I'll catch you on the next video.